Good morning. I'm Alisa Z. Thank you so very much for spending your Sunday morning here with us. You're listening to the Sunday edition, and what you may not know is we are about to kick off CRNA Week, Certified Registered Nurse Anesthetist. Boy, that's a mouthful, but I'm giving myself an A+ for an early Sunday morning for getting the words out right. And I am joined by my sister in orange, Jodie Emerson with Manna. Good morning, Jodie.
Good morning, Alisa, and thank you for the invitation here today.
I'm so glad you're here. And I know this isn't television. I wish people could see what you're wearing. That orange coat is beautiful.
Oh, my goodness. My peers from across the state of Michigan and the nation would know. They would be laughing right now because they know I like my coats and they know I like my color.
It looks fantastic. First, let's tell people what is a certified registered nurse anesthetist? Because we go in for procedures and, okay, are you going to knock me out or not? Is this a general or local? But I don't know if a lot of people actually think about the person who's taking such great care of them in that regard.
Right. That's a great question, Alisa. I want to thank you for my comment or the jacket comment. And I also wanted to tell the viewers that you're actually wearing a beautiful orange sweater with white daisies on it. So Sisters in Orange, that's where it came from. But yes, whenever you go in for a surgery, you're usually going to wear the surgeon practices. You're not going to the anesthesia provider.
Right.
So that's one of the complications. People don't recognize that they may have a choice in location.
Yes.
So when you're having your surgery booked, make sure you know which area are in network for your health insurance, first and foremost.
Okay, that's really important because I got bumped with that one time. And I loved the nurse anesthetist, and he really was worth my being there, even though his service wasn't covered by insurance. But if I had my druthers and had known in advance, I would have checked and found a place where that service was covered as well.
Right. I've had a girlfriend that was delivering a baby, and the obstetrician was covered at the facility. The facility was covered, but the anesthesia provider was out of network. So she had an $800 bill for an epidural.
No.
Yeah.
And any of us who've given birth will say, so worth it. But still,
Yeah.
that's a lot of money.
It's like buyer beware.
Yes, yes. And there are CRNAs pretty much everywhere we go, right?
Correct.
Right?
Correct.
Tell me a little bit first about MANA, about the Michigan Association of Nurse Anesthetists.
Of course, the Michigan Association of Nurse Anesthetists has been around since I think our first president was in office. And give me a second, I'm going to check my note cards on this.
And we're talking about the first president of the organization, or
yes, of Michigan Association Nurse Anesthetists was 1937 through 1939. So that's how far back our organization dates.
Wow.
Yes, our national organization actually assumed functioning in 1931.
Okay.
Yeah.
So this organization of nurse anesthetists has been around a long time. Why don't most of us know more about it?
I love this question. Alisa, we are the best kept secret in healthcare. Believe it or not, it's one of those things where you might meet us when you've been given Versed already.
And then you won't
remember us.
Remember.
No
Yes.
memory. Yeah. So that might be why we're the best kept secret in healthcare.
Well, we're all grateful for you. That's
Right.
for sure. That's for sure.
So actually, we get our roots way back in the Civil War. Nurses were giving chloroform on the battlefields.
Oh, sure.
Yes, and then we've so far come forward that we started to educate. We had 4 schools around the U.S. in the 1900s, Oregon, Illinois, New York City, and then the Long Island College Hospital. And we would educate nurses and residents to provide anesthesia at that point.
You talk about the nurses during the Civil War, for example. The minute you said that, I thought, of course, any movie I have ever seen that where there are wounded war heroes, wounded people on the battlefield, that is who we see. Very rarely do we even see doctors portrayed in those films. We see the nurses
Right.
attending to the wounded.
You know, it's very interesting as well because nursing has had, I would almost say, a minority feel within the armed services as well.
Really?
Yeah, male nurses.
Okay.
weren't commissioned until I believe it was 1957, and that was a nurse anesthetist that was commissioned. The first nurse anesthetist was Edward Lyon, and I apologize, it was 1955. I just found that very interesting.
That's fascinating. Please tell me we've come very, very, very far since then.
Oh, we have. We have. Anesthesia alone, 42.4% are men.
Really?
In nursing, however, we only have 12% of RNs are men.
Now, that's interesting, too. Of course, I guess that talks to a shift in our societal expectations and acceptance, doesn't it?
Possibly. Possibly it's not unusual that men are now caretakers of the home while the women are working.
I remember a Friends episode where Chandler was talking to a male nurse who Monica was going to go out on a date with, and he said, "Oh, nurse, pretty girly, isn't it?" And the male nurse said, "Well, didn't feel very girly during Desert Storm," those kinds of things. So we need to elevate the mindset. Somebody who wants to be a caregiver, there are great opportunities, whether you are a nurse, a doctor, a nurse anesthetist. Why do you think there's that disparity between only 12% or so of nurses being men and 42% of nurse anesthetists?
I would say that we discussed this way back when I did my RN as an associate's degree prepared nurse. And usually men are trying to sustain a family. And wages at that time for nursing in the 1990s were not enough to sustain a family. The health insurance wasn't very good for registered nurses at that time that were working full time. Again, not something that could sustain a family.
Right.
So I think we're starting to evolve in 30 years of time that, if there are great benefit packages, more men would start to come into the profession and buoy that system. In fact, I think last year, one of the Reuters network of news, they had a big expose on, you could have 1.4 million men entering nursing.
No kidding.
Yeah.
I like to hear that.
I know. I think I'm going to have to find it again, and I'll have to send that to you.
Yes, we'll have to Google that together.
Yes.
Tell me a little bit about your journey, Jodie.
Oh, my goodness. I paced myself. It's not easy to do it all in one sitting, I'll be honest. So as I said earlier, I had an associate's degree in applied sciences, and then I took my NCLEX exam. So 2 years of education. I was hired straight out of school because they preferred the associates prepared nurses at that time because we had more hands-on. We had more clinical experiences.
Okay.
And then I moved on to my bachelor's degree. And I do realize the value. I had statistics courses at that point, another pharmacology course that wasn't built into my nursing classes, as well as community health nursing.
Okay.
So it kind of rounded out that education a little bit more. At that time, I went back for a master's degree and graduated in 2004 with my master's degree in nurse anesthesia.
Okay, so like you said, you did it in bite-sized pieces.
Right.
What is it that draws people to the nurse anesthetist field?
I think, for one thing, it's very technically based.
Okay.
So coming from an ICU where you're dealing with trauma patients or burn victims.
Yes.
Or, you're already doing dressing changes. You're focused on one patient at a time. You might have a second patient, but you are focused just on the care that you're providing. You're providing care to the family, the person. You're also reporting back to physicians for any changes that need to be made.
Yes.
There's quite a bit of whole patient-centered care that we're providing, and it just segues into this extremely personal aspect of nursing, which is nurse anesthesia.
I'm not texting boys. I'm just looking up how long you've been the president of the Michigan Association of Nurse Anesthetists. So you are in the middle of year one.
Correct.
Wow,
we only get 1 year. And
really?
That's okay. Yes, the past president is still tying up loose ends from her presidency as I'm creating more that loose ends that'll come to fruition next year for myself.
What are the goals of the organization? Because it's important, obviously, especially with a field that is this wide, this vast, this big, and this important, that there are places people within the community can go.
Oh, yes. We have a mission to advance, empower, and advocate for nurse anesthetists as board-certified, patient-centered anesthesia providers who excel clinically in the delivery of evidence-based, safe, and efficient anesthesia care for our Michigan communities.
Okay. So when somebody is a certified, and we want to use those words, certified, registered nurse anesthetist, how does that differ from, say, an anesthesiologist?
Well, not all anesthesiologists, as they finish their rotations through medical school and their specialty rotation through anesthesia, sit for a board exam.
Really?
Correct. I don't know the exact statistics on that,
Okay.
but
That
I can tell you
shocks me a little bit.
100% of your nurse anesthetists that are able to practice are certified through what we call the National Board Certification. It's NBCRNA for short.
Okay.
And
I'll forget that.
I
But
know.
NBCRNA. I got it for a moment. It stuck. I just look at, for example, doctors versus nurse practitioners. And I'm not putting anybody down. I, for one, am never upset when I call my doctor and they say, well, do you mind meeting with the nurse practitioner? No, of course not. I love that. Are CRNAs to anesthesiologists what nurse practitioners are to physicians?
No, we're actually a little bit different in that nurse anesthesia and midwives, believe it or not, are kind of like the first cache of, I don't even want to say advanced practice because we weren't even that in the 1800s.
Right.
We were just the people that were skilled and we were trained with hands-on,
Mhm.
like a fellowship. You're learning from somebody
Right.
else, like a trade. And then ultimately, after World War I, people were going into schools to learn anesthesia. And then physicians were starting to learn anesthesia because there was such a shortage. Then when World War II happened, right, they were trying to get anybody in to learn
Yes.
anesthesia. So as soon, we could work side by side with anesthesiologists.
Okay.
Truly, we've learned the nursing anesthesia component. They've learned the physician anesthesia component. So if we run into a problem, if a patient has atrial fibrillation,
Right.
we are both going to call a cardiologist in,
Right.
right?
Okay.
Because they're going to
Okay.
do probably a transesophageal echocardiogram to see if there's any clots.
Right.
That's not something we do.
But you know who to call, obviously.
Exactly. Same
Okay.
thing if you have a patient that comes in and their blood sugar is like 600, 700. Well, your anesthesiologist is going to do the same thing. We're going to phone the endocrinologist.
Right.
And look
Right.
for a hospitalist to take over care for a hospital stay if they're significantly ill with diabetic ketoacidosis. So
right.
those
Right.
are things that, we're in parallel, but yet we're doing different trajectories from nursing to medicine, but we still rely on our other specialists to support the care of that patient.
It's a great way to explain it. I just want to make sure that people know if you are needing anesthesia and somebody comes in and says, I am a CRNA, be happy. Don't make that, oh, you're a nurse? I'm worried. I'm here to tell you my experience has been fantastic with CRNAs, and actually not that I've been put under all that often, but the handful of times I have, each time it was a certified registered nurse anesthetist. And my experience was great. Thank God I'm here to tell the tale, right?
Yes.
Right.
Fantastic. And beautiful white gleaming teeth. I love them.
Oh, thank you very much.
We always worry about the teeth, I tell you.
Oh,
In
yes.
case we have to place an airway, right?
Yes, of course.
Yeah.
They always ask about that. That's one of the questions. What do you mean? Well, yes, I go and get them cleaned every 6 months, and I don't think I've got any terrible things going on.
I have a funny story to share.
You know what? We're going to pause for a moment and tease people because when we come back, I want to hear your funny story.
Okay.
And we're going to talk about why celebrating CRNAs is so important, not just this coming week, but all the time. So first, I want to thank Jodie Emerson, president of MANA. Thank you so much for all that you do for us to keep us healthy and safe. And thank you for being here this morning.
Thank you.
It is my pleasure, and I want to thank each and every one of you for spending your Sunday morning here with us. Once again, I'm Alisa Z. You're listening to the Sunday edition. Good morning. I'm Alisa Z. Thank you again for spending this Sunday morning here listening to the Sunday edition. I am joined by my new best friend, Jodie Emerson, the president of MANA, Michigan Association Nurse Anesthetists. I love how much you love what you do and the importance of CRNAs. And there's a reason we're kicking off CRNA Week. But before we move forward with some of the specifics, I know we teased, you said you had a funny story for us. So I want you to share that, please.
Oh, I do have a funny story. So we were talking about just evaluating dental status before we actually do an anesthetic on anybody.
Right.
And this one patient, her eyes darted to her husband in the corner of the room. And then she came back to me and she said, no, nothing comes out of her dental work. Nothing comes out. I'm like, oh, okay. So you can't remove those. No. And then we go back to the operating room and we induce. So we're giving her medications through her IV to make her senses dissipate into a depth of anesthesia. And that's the time when we go ahead and place an airway. So we went ahead and we placed what we call laryngeal mask airway, which is the soft pliable airway that sits on top of your vocal cords. And afterwards, when the case was over, it was a quick case, we were removing the airway and out pops this bridge.
No.
So I had to change my requisite questioning about dental work into, can you remove it to be cleaned? It was so stunning to find somebody's teeth laying on the pillow next to their head. You know, we worry about people actually ingesting these or inhaling these, but there were teeth laying on the pillow.
So moral of the story, yes, we reframe the way we ask the question. Can this come out to be cleaned? And two, be honest, please, when your nurse anesthetist asks you if something in your mouth is not permanent. Say yes.
Yes.
Oh, my goodness. Not just because we don't want any more stories like this, because it really was a good story.
It was. I'm like, serious. The rest of the staff was like, their mouths were hanging open.
Did she wonder when she came back to fully being cognizant why you were all laughing?
Well, you know, the fun thing is they're kind of just at that ability to still follow your instructions.
Right.
So I put her teeth back in and she never knew what happened, truly. But
no, that is a great story.
Right. Because there is a bit of awareness without recollection. You know, you can be awake but not aware of what happened with memory.
Right.
So I caught her at that window, that
my
juxtaposition.
goodness, that is a great story.
So I'm not sure if she ever remembered to take them out the next time.
Maybe there wasn't a next time. And if nothing else, she had a good story to tell at the supper table, too.
Right? Oh, my goodness. My poor parents heard all those crazy nursing stories
hilarious.
At dinner.
That is hilarious. So now that we have the stand-up comedy routine tended to for the morning, what do you want to make sure we know? Why are our CRNAs so important to us that they deserve not only a week, but we need to acknowledge them all the time?
Well, putting us on the air today live on a Sunday when a lot of even hospital administrators and legislators are listening to the program, and also their constituents and our communities.
Yes.
They're hearing that we promote access to efficient, effective anesthesia care. 80% of anesthetics in rural America are provided by certified registered nurse anesthetists.
Wow. Okay. That's a huge number.
And there has been a huge dearth of issues across the nation with closures of rural access points.
Oh,
I'm
of course.
Sure you've heard that. Texas,
Yes.
Oklahoma, North Carolina, Georgia, they're all closing doors in rural hospitals because the funds are just not there to maintain an access point for immediate first aid care.
So what do we do?
Well, you start looking at the makeup, the complexities of those hospitals, and looking at the federal government gives pass-through funding for anesthesia services as long as they do less than 800 surgical cases per year. But these are what keep the doors open to, you know, chest pain in the middle of the winter in an area like along Route 2 in Manistee, Michigan.
Yep.
You know, going through Grayling or driving through 75, going to West Branch.
Right.
These are all locations where along your route to get up north, you could potentially pull over for an emergency visit.
Oh, my goodness. See, there's so much we need to know.
Yeah.
There just is. Now, through the pandemic, as with other people working in the healthcare industry, did we start to see some burnout there as well? Even though, I mean, a COVID patient wouldn't necessarily need a certified registered nurse anesthetist, and we're seeing the burnout with registered nurses on the wards and physicians. But was there any spillover there?
I believe there was,
Okay.
and I can't quote the data, but I do know that I read recently that they had a perspective trajectory of retirements for anesthesiologists
Okay.
happening by 2031. We would have a problem
Okay.
meeting the needs of anesthesia. But during COVID, they said there were more anesthesiologists that had left the profession than previously projected.
Okay.
So that's where we're having our problem right now. And if you understand Centers for Medicaid Medicare Services, they actually will pay for those residencies for anesthesia physicians to go through. They
Really?
don't assist in federally funding nurse anesthetists. So nurse anesthetists have got it down to quite a science. You know, they go to school year round
Right.
and then they're in clinical at the same time they're getting classwork. So they've gotten it so that, you know, they're doing their 40 hours of clinical time per week, and then they're also studying, meeting their testing during the
Oh,
semesters, and then we're preparing, ready to provide anesthesia care providers to the people of Michigan in maybe 3/4 of the time it takes for them to go through a physician residency.
okay.
So, in fact, we have 5 nurse anesthesia programs here in Michigan. There is Oakland University, University of Detroit Mercy, there's University of Michigan Flint, there's Wayne State, and there's MSU. And they are getting ready to take on, with 5 of the universities, over 115 graduates per year to help shore up the access needs for anesthesia care in the future.
And that anesthesia care is not going to be diminished in the future. It's going to continue to grow, especially as we see what are they predicting by 2060? The number of people over 60 or 65 is slated to double from the 2018 number, for example. And 70% of that group will need some kind of medical care. And we know the older you get, the more brittle your bones get. And we may be looking at additional surgeries and additional dental procedures and on and on and on. We need more CRNAs. We don't need fewer. We need to keep our healthcare system, as you said, shored up. What do you think the reason is that this field is not funded governmentally, and what can we do to maybe help turn the tide?
Oh my goodness, these are great questions. So we have Title 8, and it's basically an at your will. It's a line item.
Okay.
So every year, our senators and representatives in Congress vote on how much they're going to allot for nursing education.
Okay.
And it's not very much. In fact, when I went through the program in the early 2000s, they funded me with a stipend check that was enough to put gas in my car and maybe buy a book.
Oh boy.
So I it's just
Yeah.
it's not as efficient, I would say, with the physician way of education and training. I mean, we had to make the most of our educational time because we were
Mm-hmm.
living off of our savings or taking out loans. In fact, there are plenty of nurse anesthetists out there who would go to rural areas to work
Mm-hmm.
just so they could get their, I think it's the healthcare resource, HRSA.
Okay.
They will provide reimbursement for people that will stay in areas that are considered rural.
Okay. There's so much to unpack here. I wish we had an hour and a half, but I'm hoping you'll come back another day to talk to me.
Oh, I would love to.
Thank you. We're not quite done, though, so we still have about 5 minutes left here this morning. What stone have we perhaps left unturned, or what would you like to reiterate, and what questions should people be asking before they go in for a procedure? I know, giant question
Oh, I
there.
know. Well, we started off the top of the half hour with the discussion of, am I in network? So, yes, anesthesia departments are not hospital based at times. So, you may want to ask that question of your insurer. You
Yes.
know, is this provider at this facility covered by you? Will I be in network?
Hmm.
Because that's huge. People don't think they have their health insurance, so everything's good.
And then there's an $800 invoice,
Yeah,
like
then
you
you get that
said.
surprise bill. So it's a problem, and I know they've been trying to fix it at the federal level.
Okay.
However, I'm not exactly sure if that's trickled down yet.
Okay.
So I think it's actually spurned more of the anesthesia departments to start enrolling with the insurance companies in the states they're practicing in.
Okay. So there's potential help on the horizon, but that is a big piece, because if you find out that your CRNA is not in network, but your doctor is, you have some important decisions to make. What questions should we be asking our CRNAs before the Versed hits?
Well, we wouldn't know if we were in network for your health insurance.
Oh, that's right.
Mm-hmm.
Boy.
Yeah, that's something to take care of before you come in for your baby. But like I said before, it's we are kind of like the front
Yep.
receptionist annex, right? That's who you see, but the people
Yes.
behind the counter are the people that are submitting bills, claims, and things to the insurance company. So it's best, being a patient, to call your insurance company,
Mhm.
tell them what you're having done, and then also document the phone call for your own records,
Yes.
just in case you might have somebody coming in to do an epidural at, like,
Oh boy.
this is the big change right now, December 30th to January 1st. New groups, contracts have all been reshuffled.
Right. Right. So we are in that pivotal time point right now as well.
Exactly. So what
So
you,
much to
I
know.
know. But
So
it's like
much
buyer
today.
beware. Healthcare is a
It
business.
is.
So as a patient within that business, you're also a customer. So it
Yes.
always pays for you to do your due diligence on your own.
Yes.
Call your 1-800, Blue Cross Blue Shield, Aetna, Priority Health, whoever you're using, and find out if your hospital's in network, and then write down to the questions of, how about my physician or my anesthesia provider? I've had to do that. I actually
Sure.
had a little traumatic fall years ago up north. It wasn't during skiing, though. I was wearing some inappropriate shoe wear.
Oh dear. Oh dear.
But I had to find out if the X-ray urgent care was covered within my network
Oh,
plan.
sure.
And they guided me to an appropriate site for that to be taken care of.
Too
So,
many surprises, unpleasant surprises, if we don't do a lot of homework. And unfortunately, too many people don't know to do that homework until they've been burned. So they know it for the next time. But for that first time, they're a little bit stuck. In the 2 minutes we have left, it is Jodie Emerson World. Take us
all
home.
right. Well, I would like to tell everybody that CRNAs weren't just born, they've had critical care experience. Like I was telling you earlier, Alisa, I started out as an associate's degree paired nurse, moved into an ICU after I got my RN license, was working in that ICU for 5 years, went back for a bachelor's degree during that time, and then ultimately was a travel nurse around the country,
Ooh.
getting so much exposure. There was trauma in Phoenix, trauma in Tampa. Then I did interventional radiology in Boston. And that's when I applied to go back to anesthesia school, when I saw the nurse anesthetist doing some cases of, I think we were doing neuroembolism
Okay.
cases. And it was in radiology. It was fantastic. So they kind of walked me through it. They prepped me for I interviewed at Northeastern in Boston, and I interviewed at the University of Buffalo. And I ended up moving home again to the University of Buffalo. And then when I finished there, I moved here.
And we're glad you did.
Yes.
We're very glad you did.
So all of your CRNAs out there have had critical care experience in their past. Trauma, medic surge, burn. They've been around the block, cardiothoracic. We also have full practice authority in every branch of the military of primary providers. And that's on the front lines in Navy ships and aircraft evac teams.
I'm so glad to hear how far the reputation and acceptability of CRNAs has come. I am so grateful that you've come here today, Jodie, and I know you've enlightened a lot of people, probably saved some people some headaches as far as the monetary issue, because we know what questions to ask.
Yes.
Is there a website, real quickly, before we go?
For anybody that's interested in going to anesthesia school or looking up a little bit more information, there's the WWW address for COACRNA.org. And that's a CRNA school search that's recommended by our own professional organization.
It's a great career path. Thank you, Jodie, for being here and for all that you do for
Oh,
us.
thank you for having me today.
And
And happy CRNA week, everybody.
happy CRNA week. And thank you all for spending your Sunday morning here with us. Once again, I'm Alisa Z. You're listening to the Sunday edition.